The United States reports record levels of coronavirus cases with more than 100,000 new cases over the weekend. Hello, I'm Anand Naidu and this is The Heat. The US outbreak is growing worse by the day, with 39 states now reporting a rise in COVID-19 cases. On Sunday, the state of Florida reported a single-day record with over 15,000 new cases, and hospitals in several states are said to be running out of beds. The Trump administration is calling for all schools to reopen in the fall, but on Monday, California's largest public school districts, Los Angeles and San Diego, announced fall instruction will be online. We begin our coverage with CGTN's Owen Fairclough. Owen, how is the White House responding to these alarming numbers that we've seen across the United States, particularly in Florida, where there was something like 15,000 new cases just on Sunday?
Yeah, shattering records day by day, Anand. Well, quite simply, to your question, the White House is trying to change the conversation as much as it can. You know, for such a prolific tweeter, President Trump hasn't mentioned COVID-19 on his Twitter feed for days now. He wants to focus on other topics, for example, talking up the stock market, talking up the latest jobs numbers, which weren't that bad considering the current climate that we find ourselves in right now, and also attacking what he calls the radical left that he blames for destroying US heritage in the wake of those protests we saw following the deaths of African Americans at the hands of law enforcement. And it was at a law enforcement roundtable discussion that the US president was asked about those soaring COVID-19 numbers. Let's listen to President Trump.
We test more than anybody by far, and when you test, you create cases. So we've created cases. I can tell you some countries, they test when somebody walks into a hospital sick or walks into maybe a doctor's office, but usually a hospital. That's the testing they do, so they don't have cases, whereas we do. We have all of these cases, so, you know, it's a double-edged sword. At the same time, we have the lowest mortality, or just about the lowest mortality in the world. We're doing a great job. We're doing very well with vaccines, and we're doing very, very well with therapeutics.
Well, as is often the case, Anand, some of that from President Trump was accurate, and it's true that more testing will tends to reveal more cases, but scientists say that those tests simply do not account for those massive spikes that you mentioned in positive COVID-19 cases that we're seeing in these hotspots like Florida, like Arizona, that early on in the pandemic weren't reporting that much sickness, and now add into the mix, as you mentioned, California. On the very day that President Trump was talking, the governor of California has had to issue a statewide order ordering indoor dining to be stopped, movie theaters to close, and bars to stop serving people as well. And around half the counties in California, with pretty much any business that involves contact with people, they're having to be closed as well. So consider the impact of that now. Much of what President Trump wants to talk about is an election strategy. He wants to move the conversation on from COVID-19 to the election, hence these topics about law enforcement, the stock market, and jobs, and so on. But you have to ask yourself how much longer President Trump can continue with this strategy when the election is still 4 months away, and we're now starting to see COVID-19 surging, not just in those western and southern states and in California, but even in parts of the Midwest as well. At that same roundtable discussion, President Trump was asked if the Republican convention, that controversial convention that President Trump wants to pack with people, can now go ahead in Jacksonville in Florida, one of the biggest hotspots for COVID-19, and he could only say, we'll see. Anand.
Thanks, Owen. That's CGTN's Owen Fairclough reporting from the White House. Well, for more on the political impact of the pandemic, let's bring in our panel. Joining us from Washington, D.C. is David Charter. He's the U.S. editor of the British newspaper The Times. Also with us is Jason Nichols. He is a lecturer in African American Studies at the University of Maryland. From New York, John Burnett is the managing director and founder of One Empire Group. And from California, Dr. Rishi Desai is the chief medical officer at the health education platform osmosis.org. Thank you to all of you for being with us. Dr. Desai, let me start with you. And the big news today, as far as the pandemic is concerned, coming out of California, which is the state where you are right now. As we just heard our reporter tell us, the governor of California, Gavin Newsom, rolling back some of the reopening in that state. Bars, movies closed. Indoor dining will no longer take place in California, and schooling will be online until the fall. We've seen those big numbers over the weekend, 8,300 new cases in California. What's going wrong in the state?
I apologize for the banging. This is the nature of working from home, right? So with regards to the question, what's happening in the state is that what we saw is that political leadership was trying to follow the rules the White House set forth. They opened up the economy. And then the people living in the state of California, in particular urban centers in Northern California, Southern California, they essentially started to over-index on wanting to go out. And so you saw bars fill up, restaurants fill up, and beaches fill up. This happened 4 to 6 weeks ago and has continued. And what happens with cases is that it's, of course, delayed. So cases, hospitalizations, and deaths, it takes a while for someone to develop COVID, to go to the hospital and get really sick, to fill that ICU bed, and eventually pass away. That time lag ends up being a problem because then what happens is that you open up bars and everyone says, well, you know, there was no difference, nothing happened. But 4 or 6 weeks later, you start really seeing the impact. So as we close things down today and, you know, this week, the impact of that is going to really be felt 4 to 6 weeks from now. But we should expect things to continue to rise until then.
Right, Dr. Desai, we're also seeing Arizona and Texas shutting down as well. Now, looking at testing, there were 4.6 million tests conducted last week, but the system is backed up and it's now taking up to a week for people who've been tested to get the results. What's causing this bottleneck?
Yeah, a few problems there. You know, if you have 4.6 million tests, you know, the number you just cited, the data has to get back to the person, right? Like if I got tested today, my peak infectivity or peak contagiousness is really today, tomorrow, the next day, maybe the day after that. So if you're not giving me results for 7 days, that doesn't help me at all. I'm still spreading it. I'm still going to the grocery store and the pharmacy and getting other people sick. So that's the problem that we're facing right now is that time lag, we count that as a case that we've detected, but we didn't really effectively stop things. And in fact, I can tell you, my own family, many of them live in California. I have family members that are sick with COVID-19 right now. Not a single public health official has reached out to them, meaning that they're overwhelmed. Public health officials can't do the contact tracing that they want to do. They just simply have too many cases at this point. With all these different states involved now, yes, it's true they're trying to roll things back, but it's going to be very hard unless all of the states get on board. And at the moment, that's just not the case.
John Burnett, as we are all aware, this pandemic has become very politicized. It's become a big political issue in the country. In fact, the Washington Post reported today that the country's foremost expert on infectious diseases, Dr. Anthony Fauci, has been sidelined by the White House. The president disagrees with him and has not received a briefing from Dr. Fauci way back. The last one he received was at the beginning of June. What do we make of this? I mean, there seems to be a quarrel going on here between the politicians in the White House and the epidemiologists.
Well, the president said today that he highly respects Dr. Fauci. Dr. Fauci has been there from the very beginning. Initially, he said that this is nothing more than a common flu, and then with more information that came in and with his analysis done by his team, he eventually saw that, you know, this is actually bigger than what he initially thought, and he actually made some projections that were probably overreaching, but, you know, no one's going to hold him accountable for that. He was actually just trying to give us the worst case scenario. However, you know, what we're seeing now in certain key states, as you pointed out, there is a huge spike, but we're not actually seeing the amount of deaths. We're not seeing the amount of high level of ICU. That doesn't mean that we shouldn't be concerned. So this is a matter of really trying to balance how we need to move forward. How do we need to protect our health as a society? And I don't really see this as politics. We need to put politics aside and actually do what's in the best interest of all. How do we keep the economy going, and how do we keep people safe?
Right, John, I think what is causing a lot of concern here is the president is saying everything's fine, we've got this under control on the one hand, and Dr. Fauci is saying, no, everything is not fine. This is not a good situation that the country is in right now.
Well, we have to define what control is. Again, Dr. Fauci said that there will be millions and millions of deaths. We haven't seen that, right? What we're seeing now is a rise in cases However, at the same time, death is going down. We need to actually figure out, well, why are cases going up, but deaths are going down? We need to actually just not hear about the number of cases, but what have we learned about this virus since the beginning that would actually give us information as to why why deaths are going down at the same time cases are going up.
Jason Nichols, as I said, this has become a political issue. It's becoming an issue in the upcoming election, the November election. American voters think the president has bungled the pandemic, and that's borne out by the polling numbers that we've seen. He's trailing in several key battleground states because of that. The other thing is that voters say that, they prefer Joe Biden, the likely Democrat opponent, because he is not Trump. It's anyone but Trump. Yet Joe Biden himself has not articulated any kind of well-thought-out plan on how he would deal with this pandemic if he became president.
Right. Well, I think what he would say is that he would listen to the experts. He would listen to Dr. Fauci. He would listen to others as we learn more and more about the disease or about this infectious disease. So I think that's basically what we're saying here, is that he basically wants to follow the directions of the experts. And that sounds pretty simple. He's not putting forth these crazy ideas about disinfectants or that it would just disappear with heat, or all the things that we're hearing from the White House and from the president, who's ignoring and sometimes attacking the experts. I think Joe Biden is saying, well, from an electoral standpoint, let me just kind of stay back and let Trump make the mistakes that he's continued to make. And from a public health standpoint, I think his approach would be, I'm not a doctor. I'm not a public health expert. Yeah. I'm going to listen to the professionals.
Yeah, but Jason, what do you make?
But the professionals have said that, we'd have millions of deaths. So what are you talking about? You're not even making sense right now.
I'm sorry, I didn't.
You're totally overlooking what the experts said from the very beginning, that we would have millions of deaths. That did not happen.
And so 135,000 deaths isn't enough for you? I'm sorry, I didn't know that. Another thing I would say, sir.
Okay, one at a time, please.
Experts said that there will be millions of deaths that did not happen.
Right, right. So 135,000 are not enough deaths. He's looking for more, I assume.
No. You're playing politics right now.
The other thing that we've seen is that vulnerable populations are taking it seriously, and that has saved probably hundreds of thousands of deaths, is that people have actually ignored Donald Trump and listened to the professionals, listened to Dr. Fauci, worn a mask, stayed quarantined for a period of time, done the smart things. The reason we've seen these spikes is that people who consider themselves to not be part of vulnerable populations have gone out and gone to bars and gone to movie theaters, and then they spread it. And then we've seen maybe a slightly lower death rate, but a spike. That still puts people in danger. That's still a dangerous situation. What I'm saying is listen to Dr. Birx, listen to Dr. Fauci. As we learn more, listen to the research. Don't listen to the president opine every now and again. And I don't even know who this person is who's yelling at me. But
okay, it's John Burnett. Okay, let me move to David Trotter. Okay, one moment. Let me move to David Trotter. I want to bring him into the conversation. David, and there's a lot of other political developments that we want to talk about as well. One is the Roger Stone case. There's outrage from Democrats after the president commuted the sentence of Roger Stone, who's a confidant of the president, one of his supporters. This is what the president had to say. Let's listen.
Roger Stone was brought into this witch hunt, this whole political witch hunt, and the Mueller scam. It's a scam because it's been proven false. And he was treated very unfairly, just like General Flynn is treated unfairly, just like Papadopoulos was treated unfairly. They've all been treated unfairly. And what I did, I will tell you this. People are extremely happy because in this country they want justice. And Roger Stone was not treated properly.
David, Stone was convicted for lying to Congress under oath. But what do you make of the president saying that he was not treated fairly?
Well, from where I'm sitting, he got a fair trial in the court system in America, where he was found guilty by a unanimous decision of 6 counts. And one of them was, in fact, misleading Congress when Congress was trying to find out a bit more about the leak during the 2016 election campaign, about the leak of emails that had been stolen by Russian hackers that were from the Democratic Party. And Roger Stone, although he denied it, his phone records showed that he had been in touch with somebody who'd been in touch with WikiLeaks, who released the emails, and also that he'd been in touch with the Trump campaign, another thing that he denied. And throughout the whole case, Roger Stone consistently denied absolutely everything and tried to throw up a strange smokescreen that the emails had actually been stolen by Ukraine, which became a strange conspiracy theory that is believed by some people on the among the Trump supporters. All of this contributed to his conviction for misleading Congress. And all the way through, President Trump has complained about it, even though this is how the American justice system worked. Yeah. Roger Stone made several appeals to have his conviction overturned and subsequently his sentence overturned, and he lost them all in the American court system. So from where I'm sitting, he was treated in a normal way in the American court system, although it was admittedly a highly political case.
Yeah, it was a political case. In fact, the White House press secretary was asked about it today at the daily briefing, and she said, she was asked about, President Trump's comments that Roger Stone was unfairly treated, and she said, look, he's not the only one. He may have misled Congress, but what about the others who have lied under oath to Congress? People like James Clapper, the former director of national intelligence, or John Brennan, the former CIA head. They weren't even charged. Does she have a point there?
Well, she has a point that they haven't been charged because they would then have faced due process in the courts. But the fact that they weren't charged should suggest that the evidence is a little thin, because let's not forget that President Trump has a supportive Attorney General in William Barr, who is very actively looking into bringing charges against those who were involved in tracking, monitoring the Trump campaign in 2016 amid claims made weekly by President Trump of dirty tricks against both the Obama administration and the senior law officers at the time. My view of that is that it hasn't been brought to court yet because the evidence isn't strong enough.
Dr. Rishi Desai, I'm going to talk about another development. This concerns politics and the pandemic. The White House is pushing for schools to reopen, but members of the coronavirus task force say this is not the time for schools to reopen. We have two opposing viewpoints in this next bit of tape that we have. First from the Education Secretary, Betsy DeVos, and then from Admiral Giroir of the task force. Let's listen.
There is nothing in the data that would suggest that kids being back in school is dangerous to them. Kids need to be in school. They need to be learning. They need to be moving ahead, and we cannot be paralyzed and not allow that or not be intent on that happening.
When we get the virus more under control, then we can really think about how we put children back in the classroom. We know from other countries that particularly young children do not seem to spread the virus. We know they don't get sick. So we're learning a lot from looking at Sweden and Finland and Japan about how to do this safely.
So, Dr. Desai, what is your professional view on children returning to school?
Yeah, one thing I'll just flag is that in addition to the stuff you mentioned already, my background, I'm a pediatric infectious disease physician, so this is squarely on my plate. I guess 2 points of clarification. One is that deaths actually have been rising. I know that was brought up earlier in the segment. July 7th, if anyone's curious, is the day that they started going back up. The other is that right now it's about 140,000 deaths. Dr. Fauci had mentioned 100 to 240,000, so this is right in the middle of kind of his estimate. With schools, great question. I think that it's going to be local, right? So each community has to figure out what is the local burden of disease that we're seeing, and are we willing to take that acceptable risk? And it's a real question. I have no strong feeling one way or the other because it's a hard question to answer, and each community's got to answer it for themselves. The group that we haven't talked about is school teachers, right? So school teachers are putting themselves at risk. Many of them are going to be older and at risk for having more severe disease from COVID-19 rather than the kids themselves. Also, the fact that we believe that kids don't spread it as much based on the sightings that you just mentioned, the other countries, and that's really reassuring. And believe me, I want to get kids back in school, including my own 3-year-old son. But we have to weigh this out at the community level, of course.
Yeah, you mentioned the group teachers. There's one other group, and that is if children go back to school, they may be less susceptible to getting COVID-19, but they could always go back home and infect mom, dad, or grandma.
Yeah, exactly right. And you know, that's the kind of thinking we have to realize is that, you know, who really is that multi-generational family? Well, it's usually families that are going to be forced to live in large groups, and they're at higher risk, and essential workers that are coming home, so that kid may be exposed to, maybe exposing grandma, as well as, you know, the uncle with diabetes and other folks like that. So, you know, this is how you get outbreaks when you have these sort of situations and it's not done real carefully. So that might mean maybe schools have to break up the week. Maybe we do, you know, bring back schools a couple days in the week. Maybe you have students forced to mask, you know, those kinds of things. I think that's where you have to have requirements around masking, of course, which, should, you know, again, should be a federal mandate.
Right, John, what is your view on this? I mean, the White House wants schools to reopen. In fact, the president is threatening to defund schools that do not reopen. I'm not sure whether he can do that. And there was one other development concerning education as well, and that is the administration wants to deport foreign students who can't go back to classes, can't go back to in-class tuition. What is the president trying to accomplish with this?
Well, with regard to the college level, you know, by letter of the law, they should actually go back to their country. But, you know, I have a difference of an opinion on that, because when these students are still, whether they're taking classes online or going on campus, in-person classes, or a blended model, if you will, when they're here, they're spending money, whether it's renting in an apartment, going out to eat, things of that nature. And at a time when small businesses and other businesses need, you know, that level of revenue, that level of transaction, you know, I'm inclined to say, you know what, let them stay. There's nothing wrong with that. I think the bigger issue, it comes to public schools in terms of, you know, the municipalities. Each one will actually assess the risk, make the appropriate decisions that are in the best interest of not only the children, but the teachers and the overall community.
Jason, what do you make of that? John says, you know, foreign students should be allowed to stay here because they spend money.
Well, I wouldn't necessarily go for that argument. I definitely think that they should be allowed to stay. I think that there are many reasons that they should. Number one, many of them may come from countries where they don't have proper internet access to be able to continue their education online, which puts them at a huge disadvantage and is punitive. I don't really see the purpose of actually deporting them. I think that John and I agree on the idea that they should be allowed to stay and continue their education here online or in person. Obviously, they want, you know, the White House wants it to be either in person or hybrid, but I think under any circumstances, they should be allowed. And there are also situations where people would go back to another country and not actually have a home in that other country. So I think that it's best that we keep them here.
Yeah, John, there has been one other argument, and I've heard this. People are saying that the president is doing this to actually force colleges and universities to reopen.
That could be one tactic. You know, colleges and universities, you know, I'm a adjunct instructor at NYU. They're looking at different models. I think that what they'll do is probably end up doing something like Harvard, where in the incoming class, they'll actually be in the classrooms following all protocols, but the sophomores, juniors, and seniors, they'll have blended courses or online, if you will, because, you know, that they can't have the entire university coming on campus. So that seems like it's the best approach. However, there's some instructors that are not comfortable with teaching online. So it's actually, you know, it's a delicate dynamic when it comes down to colleges and universities trying to figure out what's the best solution.
Okay, David, I want to move on to immigration. President Trump he says he will soon unveil a bill that will contain protections for so-called dreamers. These are children who came to this country with their undocumented parents when they were kids. A lot of them have now grown up and they're now adults. This is what the president had to say. Let's watch this.
I'm going to be doing an immigration bill. One of the aspects of the bill that you'll be very happy with and that a lot of people will be, including me, and a lot of Republicans, by the way, will be DACA. We'll give them a road to citizenship.
When is this going to be
I would say over the next 4 weeks.
So, David, not so long ago, the president was talking about cancelling DACA, as this program is known. But what do you think prompted this change now?
Well, I think this case has been rumbling on for the whole Trump presidency, and it's another example of one of the Obama-era fixes, if you like, that President Trump wanted to overthrow and bring in his own way of doing things. It's been a hallmark of his presidency, really, that he has wanted to negate and change pretty much or everything that President Obama tried to carry out. I mean, the top line one here was the health reforms of Obama, which President Trump has like DACA, has been in court for the whole of his presidency to try and end. But in both these cases, which are really the biggest ones on the list, health and the undocumented children, we haven't seen any Republican plan, any clearly thought through policy that can come in. So I'm skeptical that it is actually a fully thought through plan that is intended to become law. And I think it might be more to do with electioneering. The election is in November, less than 5 months away. Yeah. And I think the administration needs to show that it's at least got an idea of where it's going to go in a second term, because President Trump has been pretty light on what he hopes to achieve in a second term, beyond recovering and restoring the economy, of course.
Right, David, I've just got a little bit of time left, and I want to get your view on something, another development, and this goes back to the pandemic. Europe, the countries in Europe have largely reopened, but significantly there is one sort of ruling that Europe has taken, that people can visit Europe right now, except the United States. Americans are not going to be welcome in Europe right now. This led one commentator this week to say that the US passport is effectively useless right now. How significant is that when Europe says, look, we don't want you here right now?
Well, it's significant for me and my family, who've cancelled our trip to see family in the UK this summer, and probably may not even be able to go for Christmas. We shall see. It's 5 months down the line. But I think the significance, of course, is that President Trump's big boast going into the election from his 2016 campaign was that he was going to make America respected again throughout the world. Now, the economy that he built was unarguably a roaring economy with very high unemployment across all sorts of different groups. But that's collapsed now. He can't live on evoking what might have been and what had been. He needs to start showing America some real achievements, such as restoring international travel. But the only way he's going to do that, going back to your initial discussion, is to get on top of the virus.
Okay, and that's where we'll have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C.